Hello, everyone, and welcome to the Talk They Hear You podcast, What Parents Are Saying, Prevention Wisdom, Authenticity, and Empowerment. This podcast is brought to you by the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. Talk They Hear You is a national prevention campaign that aims to help parents and caregivers talk to their kids about the dangers and risks of underage drinking and other drug use. In this podcast, we'll hear what's working and what isn't, and what might be missing in our efforts to help kids navigate away from alcohol and other drugs. I'm Debbie Burnt, Director of Parent Movement 2.0, and I'll be your host for this podcast. As a reminder, the views expressed here are not necessarily those of SAMHSA or the U.S. Department of Health and Human Services. Just a quick note, you may notice a short audio glitch around the 4-minute mark. It's only about 30 seconds, and we left it in because the information you can hear is valuable.
If I stray in numbers, part of a pack, share goodwill together in this life.
In today's episode, we are honored to be speaking with Dr. Leslie Walker Harding from the University of Washington and Seattle's Children's Hospital. Hi, Dr. Harding. How are you?
Hello. Good to see you, Debbie.
Thank you. I was saying earlier, you may be one of the most perfect expert guests that we could have on this podcast. And I wanted to spend about 2 minutes talking about your background so that our listeners can understand that. Dr. Leslie Walker Harding is currently the Ford Morgan Endowed Professor and Chair of the Department of Pediatrics, as well as Associate Dean for the University of Washington. She's also the Chief Academic Officer and Senior Vice President for Seattle Children's Hospital. She's been dedicated to the health and well-being of children and adolescents for over 25 years, particularly in the area of prevention around substance use and promotion of healthy adolescent development. Her focus is to raise awareness of and bring to a national scale evidence-based interventions to prevent substance use and mental health conditions in children and adolescents. She is truly a rock star in this space. Undergraduate from Stanford, medical training at the University of Chicago and UC San Francisco, all in adolescent medicine specialties. She even developed the adolescent medicine program for Georgetown. She is a past president of the Society for Adolescent Health and Medicine. Previously, she was a division chief for the Adolescent Medicine Department at UW. She was a co-director for Seattle's Children's Substance Abuse Program for Adolescents. She's been appointed to so many national committees and elected to so many councils that we just don't have enough time to talk about them today. Currently, she's also chairing a collaborative effort on healthy parenting in primary care through the National Academies of Medicine Forum of Children's Wellbeing. If you're a parent, Dr. Walker Harding is someone you want to hear from. So let's talk. Again, thank you so much for being here. We really want parents to understand what's at stake with underage and adolescent substance use. Can you tell us about your work with kids and substance use and anything that you think would help us frame or start this conversation?
Sure. And thank you for that really generous announcement. I think that the most important part of that is that I care about teens, and I've spent my full career really trying to improve the health and well-being of kids. And one of the most important things we can do is give them a good start. And as I went through my adolescent medicine specialty training, I saw substance use way back then as something that really was preventable. And if it isn't prevented, could really change kids' whole trajectory in their whole life. So I got interested very early, and I did some early work with some other researchers looking at nicotine and ADHD. We looked at what kind of treatment programs can be useful for adolescents, because many of the treatment programs that are used today were actually developed for adults, and adolescents are really their own. They really need their own special attention. So I did some work there. And when I moved to Seattle, one of the things I did do was start a substance use treatment program. Again, that's something that you don't always see for adolescents, and especially adolescents who have chronic conditions, who also have the same risk of using substances, but much less access to resources to help get treated. So I've done that work. I think as over the years, what I've really pivoted to is some of the prevention. I've really focused a lot around prevention and the fact that parents are looking at research are really the most powerful people to be the definer of whether or not a kid begins to use substances early or not at all. And I wanted to spend much more of my time in that kind of prevention work and getting those things out there so parents know they have the power, to make a difference with their kids and, how to do that.
That is really a powerful statement, that we as parents have so much influence over our kids and whether they're using substances or not. I am a parent. I have 3 kids, 2 are grown, one's about to graduate from high school. And this is a really hard job. And we have a lot that we have to manage as parents. And when you get into high school, it feels like your kids really aren't hearing you or listening to you, and that your influence really is different. So can you talk to us any more about how you know that our influence is actually making a difference?
Yeah, when you look at research and you look at the kids whose parents had clear values, understanding about how drugs are or are not to be used in their home, the kids whose parents have spoke up and said, in this house, we don't use drugs, we don't smoke marijuana, we don't drink alcohol. When you're a kid, those kids were much less likely to use during adolescence compared to the kids whose parents didn't give them any message. Because for a teen, no message is actually permission. And that means, oh, my parents don't care, here I go. Kids really do want to be in their parents' good graces. They really want to still impress and have their parents think highly of them, whether they say it or not. And to know that your parent does not think this is something that our family does, that you think is healthy, that will be good for them in the future, makes a difference. And every time you look at it, it's dramatically different for the kids who had no message or, had a message that it was okay versus the message that at this time in life, we don't in this family have our teenagers and children using substances. That makes a powerful message, just that alone. The other thing would be having clear guidelines, clear rules, clear and appropriate consequences for behavior. I say appropriate because that's sometimes people go overboard, sometimes people don't do enough. You really need an appropriate consequence for behavior.
And let me just ask, where do you see appropriate consequences?
Well, I think what a parent should do is what they can follow up and really do. When I hear parents say, well, you're grounded for the next month, you're grounded forever, or, you can never drive again, things that actually are not going to probably be possible to carry out, those things that you lose credibility with your kids. So you have to do things in a way that are more measured. Okay, so the next party, you're not going to be able to go to the party this evening. Just things that are very clear that you can actually do. And then the kids will have faith that when you say something, it means something and you're going to follow through.
So that's a great reminder for all of parenting, right? I want to talk to you a little bit more about kind of the risk relative to using underage, because I think as we parent, it's hard to stay committed to the no drugs and alcohol in high school. And if we have some information about why we want to stay committed, I think it might help parents. So one of the things that we hear from people in prevention is that adult addiction is now understood to be a childhood onset disease. Do you agree with that? And what would you tell us about that? What are really the mechanisms underneath that, if that's true?
Yeah, I actually start every talk I do about this with a slide that says substance use disorders is a childhood onset disease with adult manifestations that happen later. Almost everyone that ends up with a substance use disorder began using during their childhood or adolescence. It's very powerful. The younger a child is when they try their first substance, and I've had kids be as young as 9 and 7, the more their brain will be willing to accept that substance is something that needs to be there. So 1 in every 4 to 6 kids who tries a substance will be likely to have a substance use disorder in adulthood. If you wait till your brain's more developed, till you get closer to, as an adolescent medicine person, I'll tell you closer to 25. I know that's harder to do. But as you get over 18, 19 into the 20s, only 1 in 10 people who try a substance for the first time will end up having a substance use disorder. So we know that the younger you are, the more pliable your brain is, the more willing it is to incorporate some things, and the harder it is to undo it. When I first started in this field, you had to contend with people that said kids can't be addicted to drugs. Kids can't have a substance use disorder. That's impossible. And that's not true. And in fact, it's so far the opposite. We need to get that out there.
That is amazing. I mean, when it's almost all, it's a statistic that's so staggering. You never see such clear statistics, I think, in anything. So the amount of influence parents can have on the health of their children is truly profound in this area. Is addiction considered hereditary? Do kids that have family members that have use disorders, are they at a higher risk potentially?
We have a lot of studies that show that kids are at higher risk when their parents have a history of substance use disorder, alcohol use disorder. So yes, can I tell you that your family has this gene and that's why, no, the science isn't that far yet with that detail. However, there have been a lot of studies looking at twins who maybe were not raised by their parents, twins who are not raised with each other. And you look back and they see, okay, this parent had an alcohol problem. Those kids, even if they weren't raised by that parent, still had a higher incidence of substance use disorder themselves. So there are a number of studies that really tell us that there's something genetic going on with that. But it's not the only thing, because if you never try the substance, if you don't put it in your system, it's not just going to manifest by itself. So still, the longer you delay, even if there is that family history, it doesn't mean it's inevitable that your child is going to end up with the same history and the same concerns when they become an adult.
So that sounds like it would also argue for talking to your kids about family history, if there is indeed some. And I know that's really complicated because substance use and inside families is, some families talk about it, some people don't, some we recognize, some we don't, but it sounds like it could be prophylactic to arm a child with that info.
Yeah, it depends on how you do it. In adolescent medicine, it's very clear. If a parent, let's say, most kids, again, look up to their parents. So if a parent says, when I was your age, I drank and I had a lot of problems with that, I wouldn't have you do it. Well, what the kid hears is, wow, my parent is awesome. And he drank in high school and he's okay now, so I'll be fine. So telling your personal stories of when you were drinking as a kid or when you did this or took this drug, that's not really helpful because the kid's going to see it in a completely different light, regardless of what you say. But to say that our family has a history of addiction, our family has a history of substance use, and that makes you more at risk. Kids hear that, and it's important to hear. Now, what the other part of that, I think, and again, it's complex, is that if you say that we have alcoholism in our family, what a teenager may hear is, oh, I shouldn't do alcohol, I'll do marijuana instead, or I'll take an opioid. Substance use and how it works in the brain doesn't work that way. If you were sensitive to alcohol, your child may actually be sensitive to any substance that's mind altering. So it's important to have that. But I think it's important for kids to know about their family's history, but not necessarily about all the glory days of, what happened or even the bad things that happened, because kids don't process that the same way you might think.
That is a brilliant distinction and a really important one. So let me talk to you about substance use and mental health. We understand that substance use can actually cause mental health issues like anxiety and depression and suicide attempts. Want to see if you agree with that and tell us anything else about it. There's this conversation of psychosis that has kicked up, especially around marijuana. And just want to maybe dispel, if it's worth dispelling, or add to this idea that if a child is using something heavily, lots of times the narrative around that is they are medicating or trying to medicate an underlying mental illness. So I'm guessing that is true, but I'm also wondering, is there a chance that they're creating that mental illness with their use?
It goes both ways, for sure. You can have a child who probably would have otherwise not have had depression, anxiety, difficulty with sleep, suicide attempts if they had never used. When you use these substances, they deplete the normal hormones and chemicals in your brain that you need to have normal ups and downs and be able to address your emotions well, they deplete all of those and they replace them with the drug that you're taking. So that inevitably over time takes you lower and lower and lower, whether it's alcohol, whether it's marijuana, whether it's opioids, it doesn't really matter. They deplete the natural hormones in the brain that you need, to the point that when you have kids who are going to recovery, a lot of times they'll tell you, well, the first 6 months, first year, I just felt empty. I felt emotionless. I didn't feel anything, because it takes time for those hormones and chemicals to kick back in and realize that, okay, it's time for me to start producing these normal, healthy things like dopamine in the brain. So that's very powerful. So yes, if you weren't having emotional or depression or anxiety problems before use, if you keep using, you're gonna see some of those things occur. And if there are kids that absolutely haven't had a diagnosis for what's wrong with them, they haven't been told they had anxiety, depression, they don't know why they're feeling bad, there's things happening, they're traumatized, and they don't know how to manage that in a healthy way, and they may begin to use substances. Now, using it heavily would mean to me they probably already have a substance use disorder, right? And so that's going to take you to using more and more and more substances. But really finding, there's research looking at when you have kids that have co-occurring disorders, and well over half of kids with substance use disorder also have anxiety, depression, some other mental health disorder. If you treat them both at the same time, you will see the kids get better. It used to be that you have a kid and he might have a substance use disorder. Maybe he's using marijuana and he's depressed. And they would say, well, you need to stop using marijuana before we can treat your depression. And that's devastating, doesn't work. So there's been more research showing that with teens, you need to treat both at the same time. And if you do that, you will see them get better.
That's hopeful message at the end as well. I kind of flippantly sometimes say, when you raise teens, all of adolescence kind of feels like one big mental illness, because they're, the emotional swings, the highs, the lows, the weird logic, screaming, at least in my house. How do we make sense of, as parents, something that is normal adolescent behavior versus something that really might be a deeper concern that we should activate on?
I think there's some simple things. There's always kind of the myth that your kid was wonderful and they get to be a teenager and then it's just horrible and you don't know what to do and it's just like another person in your house. But in reality, their hormones are going up and down, they're growing, all kinds of things are happening in their body, their brains are changing. So they might have ups and downs and be moody. They might be happy one minute and tell you, no, I will never wear that again, and storm out of the house. But the thing that's different about kids with a mental health challenge is that the whole house is disrupted by that child. I remember a parent saying, when I put my hand on the doorknob to walk in the house, I just cringed every time I walked in because I knew something was going to be a problem. That's not normal. Most kids, they're going to have their ups and downs. It'll be fine. They'll come back out, give you a hug, sit down and eat like nothing happened. That's kind of normal. But when you have a situation where your child is disrupted, their school's not going well, whatever it is that's important to them isn't going well. They're not seeing their friends. They're changing to friends that also seem to have the same kind of mood issues, and they're not swimming or doing whatever it is that they love to do. You're seeing them pull themselves into their room. You're tense. Everybody in the home is tense. That's not normal, and you need to go for help. And so, that's the difference to me. The functioning of the family decreases, the functioning of the child decreases. That's very different than just, having your ups and downs in your moods.
I could have used that information about 7 years ago. It's a great distinction, because sometimes those mood swings last for a couple days and you lose perspective. So I wanted to talk about the limbic system a little bit. We hear that that's the major focus of brain development for adolescents. And can you talk to us a little bit about what type of development's happening there? And my goal is to hope that if parents can understand that a little more, they can be more effective in the way they approach situations. My one example is, I've always been told that, where do you fit and how do I belong is a big adolescent developmental thing. So that is at least in part where some of the peer influence and peer pressure can come from. And I know as a parent, any parent who has ever said, I don't like your friends, I think your friends are a bad influence on you, that conversation has gone well, precisely never in the history of parenting. So is there a way to understand that time of development so maybe it can be more effective? Don't talk about their friends. Let's talk about things that we do as a family, things that you do well. Where do you fit in the world? And just have a broader conversation. That's a lot there. So, however you want to respond to that's great. But I'm trying to give parents ways to be more effective.
Yeah, I think you said a lot of things there. When you're dealing with a early middle adolescent, the most important thing, their brains are wired for risk. They need to take risks. Now you want to put them toward healthy risk, but they need to take risks in order for their brain to fully develop, for the brain to know what to prune during this really active time of development in the brain, and what to hardwire and say, this is where we're going as, this person, as they grow, this is going to be important for them. And one of the things with that is their kids, that one of the most dynamic times is when their bodies are changing almost overnight, and their brains and who they are, they need to know, who am I apart from my family? Who am I? And how do I figure that out? So they try on a number of identities. You can come one day, they're wearing all black. The next day, they're going to the festival. They're trying on many things to see what fits. And they might try even different friends groups. And it's okay. They might shave all their hair off and then they turn it pink and then they just have one ponytail. All of those things are important for them to see what fits. But when you see a child begin to change their friends and you say, oh, this friends group, seems to not be a good influence on you, you got to think even further than that, because kids don't hang out with people that they don't want to either be like or be liked by. And they won't. They'll pull themselves out. They'll be by themselves. They just won't hang out with people continually that they want to be like. So when you see that, you've got to ask, well, if all the kids look kind of depressed or all the kids look like they're doing this, that might be something that your child is trying out, or they think that that's where they want to go. And it's really time to assess what's going on. But instead of saying what's wrong with your friends, why are these friends interesting to you? What is it about them? And sometimes, very much so, kids who are depressed are not going to want to be with people that are happy and jumpy, and because that's not where they are. And so you're going to see friends that kind of have the same mood as your child, and that's a signal to say, hey, what is it about your friends that's really important to you? And try to figure out what's going on, because that's a better way to figure it out, I think, to me.
That's great advice. I feel like it's such a hard developmental time, but at the same time, there's so much feedback that they get, like every time they do anything. If they show up at a party and it's uncomfortable, the amount of feedback they get and the amount of life skill development they achieve if they endure that discomfort and keep moving. You want to show up sober to your life from 12 to 18 just so you get all that feedback, right?
Absolutely.
So I think I'd mentioned that when we talk to parents, sometimes they'll say, I don't have as much problem with my kid as I do with the adults in my life, because we have so many parents and adults that just either aren't sure, aren't thinking about substances, felt like they were fine when they were in high school, just aren't worried about it. Is there anything that we can do to help more parents embrace this no drugs or alcohol in high school, and by deduction, prior to high school too?
I think parents, this is just like when kids are 0 to 5 and there's all those little groups of parents that meet together and go through preschool and get to know. It's the same type of time during adolescence where it's real important to have your friends group, friends whose kids are about the same age going through some of the same things. You need that support, because if you're more isolated, you're not going to know. Of course, every child will come home and say, I'm the only one that doesn't get to drink alcohol. I'm the only one that's not going to Alice's party. You hear these things and you might get kind of twisted up about them when really maybe nobody's going to the party. So I think it's real important to have peers and to develop that. And there are a lot of parents, I think, because we have so little education about substances and the power they can have in changing a child's trajectory. I think there are a lot of parents think it's perfectly fine. I think there's also what I've heard before is parents say, well, my child is different. She's really mature. She has straight A's. We let her have parties on her own. We just go upstairs and, it's fine. We get a little keg and, they're all fine. I will tell you in my whole experience as an adolescent medicine specialist, I have never heard of a party that was fine. Either kids are drinking too much on the light end of things, problem. I see things where kids have been assaulted, kids have died, kids have gone out and had an accident and fallen, and you're drunk, you don't protect yourself, a whole range of things, to just being bullied and feeling uncomfortable and awkward. There's a lot of things that happen when a party's unsupervised or undersupervised. And what I've seen are parents that gather together, either from the parent PTA groups, they gather together, they join. In a lot of places, there are coalitions for prevention of substance use, and parents gather there with other parents to help make sure that there's safe, healthy environments for their kids to take healthy risks without having to really compromise who they are and have trauma happen to them. You have to take the same effort as when your child was little to find that group. You have to do that again during adolescence, and find that group of parents to give you support, because I think doing it alone is almost impossible. It's really hard. And kids knowing, I've even seen parents where they sign pledges together. Well, these are the 7 houses that are safe, and I'm fine because we all have the same values, the same understanding about substances and how much time they get kids to be unsupervised. So I think there's a lot a parent could do, but you have to be active.
That was brilliant. This is a prevention program, and we try to focus on prevention. But for families where use has started and or it has ground into really problematic use, the whole treatment and what to do in that space is just, to me, it's a daunting jungle of things that you have to figure out. Is there anything you would tell us about how to navigate that? And then I had a friend years ago whose son was using a lot of marijuana, and the practitioner that they were going to said, "Oh, it's fine, don't worry about it." And I'm guessing that's not said as much anymore, but if a parent were to hear that, do you turn around and run? How do you navigate?
Well, I think one of the things that I used to see a lot when I did primary care, adolescent medicine, pediatric practice, was I would have the parent call and say, "I'm on my way. I found marijuana in my child's bag and I'm on my way to get a drug test." Or they'd say, the school called me and said this, and I'm coming in because I want to know what's going on and what I can do. And what I tell parents is, you have to, one, if your child has other people's substances, they say, "Oh, it's John's, it's not mine, I'm just holding it for him." That's never true. Just so you know, that's never true. It's a common thing people say, because nobody that has drugs gives their drugs to somebody else, because that's a highly valued thing. You don't give it to other people, you keep it. And if you find out your child, somebody says, "Well, I saw your child smoking out after school, I saw him," don't assume. You just need to get that checked out, because a lot of times parents may even know, "Oh, my child drinks a little bit," or "I know he smokes every once in a while." As a parent, you will not know the full extent, period. So you need to have somebody who can talk to them confidentially, figure out what's going on, and see where they're at. I would say parents tend to know that their child may be using something when they are, but they never know the full extent. And if it's acceptable in the family, they're going to do more. Whatever is acceptable in your home, you can guarantee your kids are going to go further, because they need to test those walls and the limits of things. So I think that's important. So when you go to a doctor and a doctor says, "Oh, that's no big deal," what I want you to know is most doctors, I would say 100% of them, unless they're being trained right now, which means they're not your doctor, have had 3 hours in their whole training around substance use. So
Wow.
a lot of doctors are working with their own personal beliefs about substances. So I think it's very important to reach out and get a referral. Now, I don't think you have to not see your doctor, because I think it's a problem in the healthcare field that we didn't really learn and train in this. Unless you took, you made a special effort, you're not going to. But go further, get some more help. Look and see where you can get an assessment for your child, because the earlier that there's an intervention, the better it is for your child, and the more likely they're going to be able to put that behind them.
That's fantastic perspective. Thank you so much. This has just been a fantastic discussion. Is there anything else you would tell us or leave us with today?
No, I think you really hit on the good questions that I've heard parents ask for years. I think this is really good. The only thing I would mention is scare tactics don't work. Just remember, terrifying your kids, telling that they're going to grow horns or they're going to be damaged for life if they smoke one, those kind of extreme things, they don't work. So really go back to the family values, expectations, having consequences for behaviors, those kinds of things really help. And just have fun. I love adolescence. It's a wonderful, beautiful time where their brains are developing, they're learning, figuring out stuff, and you'll miss it when they move to the next level. So just enjoy the time and get your friends to hang out with when you're having tough times.
Thank you so much. We really appreciate it. And maybe we can have you come back sometime. We do want our listeners to know that you are on Twitter at AskTeenDoc. If anyone wants any more of Dr. Walker Harding, it's really great to understand substance use from this clinical perspective. So thank you. To wrap up, we want to remind listeners that all Talk They Hear You materials, including this podcast, can be found on the Talk They Hear You website, which is talktheyhearyou.samhsa.gov. So the 4 words spelled out, talktheyhearyou.samhsa.gov. Please share the site and this podcast with your friends. The more we can be in conversation with each other, the better for everyone, especially our kids. And lastly, we would love to hear from you. What would you like to hear on the show? Would you like to be on the show? Do you have any stories, tips, or techniques that have worked for you as a parent that you'd like to share? If you have any questions for us, any ideas for topics, any feedback for improvement, please be in touch with us. whatparentsaresaying@gmail.com is our communication channel. And want to thank everyone for joining us, and we'll see you next time.